having a discharge, vaginal discharge, is very normal.
Mm-hmm.
So what you need to differentiate maybe is what is a normal discharge
Yeah.
and when is it concerning that I should visit the doctor.
Yeah.
Now, the normal vaginal discharge is usually clear, sometimes whitish or off-white.
Mm.
And a normal vaginal discharge should not have a foul smell
Yeah.
or an unpleasant
Smell. So tukiingia kwa vaginal discharge,
yes,
because there is a concern that also women have about vaginal discharge, which is the color of the discharge, the smelly part of it. Is it normal to have a discharge? Is it abnormal not to? You see, all these things.
Yes.
So vaginal discharge.
We've handled this matter many times.
Yes, that's
and it
true.
keeps on coming because it's a concern. And there's a lot of misconceptions, a lot of myths about vaginal discharge.
Yeah, that's true.
And some women believe they should not have any discharge.
Yeah.
Having a discharge, vaginal discharge, is very normal.
Mm-hmm.
So what you need to differentiate maybe is what is a normal discharge.
Yeah.
And when is it concerning that I should visit the doctor.
Yeah.
Now, the normal vaginal discharge is usually clear, sometimes whitish or off-white. And a normal vaginal discharge should not have a foul smell or an unpleasant smell. And in terms of the texture, or what you call the consistency, for some women it's thin, also depending on the cycle. Yeah?
Oh, yeah.
It can either be thin, sometimes it can be thick, and it can also be sticky.
Oh, yes.
Yes. And you'll find some women, they produce the discharge almost every day.
Daily.
Yes. But most common, the amount of discharge will increase and will change its consistency during ovulation.
Oh, yeah. That's
yes.
true.
For ovulation discharge, it becomes more clear and it's a lot because the reproductive system is preparing to get pregnant. So that's the best environment to get pregnant.
Juicy.
Yes.
The gents can let us know. They know it better. They know that environment better.
Yes.
So during the ovulation period,
yes,
it is, and it also depends now with the consistency of it.
Yes.
So past the ovulation period, then you have your periods probably come, and after your period, you still having a discharge. There is, I'll say this, that part where after your period, you're having a slight discharge, probably ile tutaita period inaisha.
Yes.
So it's like brownish. Yeah.
Yes.
So now it's 7 days after your period, and you're still having a discharge. There is a foul smell, and you're wondering,
hapo kunaendaje?
Kwani hii ni ovulation imeanza haraka aje?
Now, some women get some brownish discharge before their periods.
Okay.
Then the periods come. And for some, after their periods, there's that slight, sometimes spotting.
Yes.
Or a brownish discharge. It should not extend until ovulation. Yes. And more so, the brownish part.
Okay.
When your discharge is brownish or dark, it means there's an element of blood. Yes. And your menses should not persist more than 7 days, more than 10 days, more than 14 days. Now, during ovulation, there's some women who they can have spotting.
Yes.
The day of the ovulation. That is normal. But it should not persist. And what you should take home message is, between your periods, let's say the periods have come, na zimeisha.
Yeah.
From the time periods zimeisha until the next period, in between there, you should not have blood that is persisting.
Oh, yeah.
Yes, there should be no bloody discharge or a brownish discharge or the same symptom you get after sex.
Oh, yeah.
You should not bleed after sex and it should not be consistent. That every time you have sex, there's a bloody discharge.
Yeah.
If you have a bloody discharge, you need to visit your gynecologist. And more so,
soon as possible.
if it's not during your period. Of course, during a period, you'll have a bloody
discharge. That's
yes.
true.
Yes.
What about the cramping, the muscle cramp? Umbali pia. It shouldn't, it's okay to have it.
During ovulation, it's okay to have cramps.
The cramp.
And also during periods.
Yes.
You can have mild cramp, but not severe. We've discussed that as well.
Yes, that's true.
That even during ovulation, your cramps should not be so severe that it interferes with your daily routine and daily activities. Yes, you should not be told your cramps ni normal, wewe endelea na shughuli zako. Now, if you have a discharge, an abnormal discharge, that comes with cramps, that now could mean something very different.
Yeah.
It could be an infection, yes, but an infection that involves the upper part of the reproductive system. And that's when you have to rule out issues like PID, that is pelvic inflammatory disease. And you can even have a UTI, urinary tract infection. That usually gives you some form of pain in the pelvis or cramps in the pelvis. Yes.
Sawa. How do I keep the pH of my of my system well? How do I balance that?
Now, how do you balance the pH? Because if your pH, the pH of the vagina is not balanced, that's when now you have infections coming in.
That's true.
Yes. I think we should have started with that. It's called the normal flora.
Yes.
Of the vagina. Now, the vagina is created in a way it maintains its environment.
Yeah.
Without even washing, without applying anything, without using any herbal, it washes itself because of the hormonal changes that occur.
Okay.
And in terms of the normal flora, we have the normal bacteria that is in the vagina.
Okay.
That normal bacteria controls the pH. And the pH of the vagina is such that that pH is not conducive for other abnormal bacteria to come in.
Oh, yes.
So if you interfere with that pH, you get other infections. So first thing, personal hygiene. Very important. I should not overemphasize on that.
Oh, yes, true.
And the personal hygiene should be during periods and also outside your periods.
Yeah.
Number 2 is a balanced diet. We've mentioned that before.
Very, very important.
Avoid what?
Avoid sugary
foods.
Oh, at all costs.
At all costs, avoid sugary foods. Carbohydrates are a main culprit. Kenyans, we love ugali.
Kabisa.
We love chapati. In Mombasa, mahamri. Viazi karai.
Biryani.
Those are the things that are not conducive for your vaginal health.
Yeah.
Yes, and they might alter the pH because of a lot of sugary foods.
Yes.
Which is a good environment for infection. So there are some women who come with frequent infection, and the only advice you give them is that cut on carbohydrate, cut on sugary foods.
Yeah.
And they're good to go. They become perfect, and the recurrent infections clear.
Yes. That is great.
Then avoid douching.
Yeah.
Avoid those many things that there are so many products in the market.
Oh, yes,
I don't want to mention them. Yes.
That's so true.
Use this, it will wash your vagina.
It will tighten. It will.
Go and do steaming. They use herbal.
Yes.
All those don't help. Your vagina cleans itself after periods. Because after periods, there are some women who also they clean the inside part of the, just clean the outside part, which is what we call the vulva. The external part of that is on the lips. Just clean the outside part. The inside, nature cleans it.
It does
it cleans itself. And if you try clean the inside, you affect the normal pH.
That's true.
The normal flora. Now you increase the risk of infection. Okay?
Okay.
Yes.
Thank you so much, Dr.
Karibu sana.
Again, we are here to learn, to unlearn. Yours is which one? Which one are you doing? Are you learning or are you unlearning?
Maybe I should also mention the different kinds of discharges that you have. Now, we've said the most common discharge and the normal discharge. That one we've mentioned.
Yes.
Now, when should someone be concerned.
That's true.
If your discharge increase, and maybe you're not taking any hormonal drugs, you've not traveled, then you should be concerned.
Okay.
If your discharge become bloody or brownish, stained, or greenish, slight yellowish is normal, but if it's yellow,
deep yellow,
yes, that one is a concern.
Okay.
So that is the color part.
Yeah.
Now, if you get an unpleasant smell, the odor is not the normal one that you usually smell.
Yeah.
That is foul smell. That should make you go to the doctor immediately. That one you don't even wait. Yeah. That is immediate. Now, the consistency. We've said usually sometimes it can be clear, it can be sticky, but if it's very thick and clumpy, that could signal a yeast infection.
Okay.
And yeast infection, or what you call candida infection, is one of the most common causes of abnormal discharge in women. Yes. Now, if you get a greenish discharge, that is a different type of infection. And there's another discharge that is, it's a fishy smell.
Yeah.
It smells like fish. That is another type of infection, yes. So there are some symptoms you'll tell us, and we'll know that is a specific infection.
Type of infection.
So you need to know your normal discharge, and when it's abnormal, you need to note the consistency, the color, the smell, and if you are itching or if there's a burning sensation.
Yes, that's true.
That too as well.
And can you get a discharge in case you're pregnant and you get a discharge? Should it be a concern? And it's just like a clear discharge. Should you be concerned?
Now, during pregnancy, and more so in the first trimester, because of the hormonal changes.
Oh, yes.
The amount of discharge will increase.
Okay.
Yes, that is very normal.
Oh.
But it should not itch, should not have a burning sensation, should not have a foul smell. And it should not be blood-stained.
Blood-stained.
Yes.
Just a normal creamish or the whitish discharge.
Or whitish or clear. Yeah. It can increase in amount during pregnancy. That's very normal.
Oh, okay.
Yes.
Again, learn and unlearn. Which one is yours? Asante sana, Daktari. Thank you so much for being here. Thank you for gracing us, and thank you for answering the questions.
Karibu sana.
And again, we are still here to answer more and more and more questions. Daktari pia anapatikana Jubilee Insurance Plaza Building, first floor, Modern Gyno Clinic.
Thank you.
So our socials, hapa tu. TikTok, Instagram, YouTube, Facebook, mutatupata kote kote.
Thank you so much to those who follow us on our YouTube channel, on Instagram, on TikTok. We are always ready to educate you. We might not answer all your questions, sometimes because of privacy. We might not discuss a lot of private matters on social media. That's why most of the time we advise you to visit us if there is a problem. Once we discuss it one-on-one, then you get a clear picture of what is happening. And also there's a benefit of doing an examination. It's not just, we don't just treat the symptoms.
Yeah.
We also treat and examine and now find out what the problem is. Karibuni sana.
Santeni.